everyone. My name is Griselda Kochari, a lecturer in the Department of the Medical and Technical Science at University Aldent. This paper is part of the doctoral study in the fielding of immunology when I am following this presentation, we will focus at the beginning of the introduction, when we will present our study in summarized way and the reason that encourages us to carry out this study. Then we will deal with the method and methods followed, which include the questionnaire, laboratory test, and statistical test. Finally, we will present the result of the study and the conclusion. On the basis of this, open discussion can be held on this topic. The purpose of this study is to identify whether lifestyle is a risk factor for possible insulin resistance and consequently for the development of type 2 diabetes mellitus after the COVID-19 pandemic. Insulin is the hormone responsible for the homeostasis of the glucose level in the blood. Insulin resistance is one of the primary causes associated with the type 2 diabetes, as shown in the figure on the left. Insulin resistance is also related to another clinical situations such as obesity, coronary disease, nephropathy, as you can see in the figure on the right. This is a simple diagram which illustrates the vicious cycle of unhealthy lifestyle which can eventually lead to diabetes. Material and methods. In this study, we use the first, the questionnaire, second, laboratory test, and statistical analyzer. About the questionnaire, a random sample of 15 students from different parts of Aldent University has been selected to fill in the questionnaire. The first part of this questionnaire suggested information on simple habits such as smoking, physical activity, alcohol drinking. For these students, take as consent for performing phlebotomy. About laboratory tests, we take the fresh serum sample. A phlebotomy was performed to 44 individuals. The laboratory data of glucose and triglyceride tests for each patient were used to calculate the triglyceride glucose index, which is an easy, fast, and low-cost method. In fresh serum, we measured two tests: the triglyceride test with endpoint methods, triglyceride oxidase, and the blood glucose test with the endpoint methods with glucose oxidase. This analysis was done by using the Smart device ELITech. We also check the sample for signs of hemolysis, ictus, and lipemia. The triglyceride glucose reagent were kept at the specified temperature before the test, and we did calibration and control processes after each test. Before statistical analysis, participants were classified in five groups of smokers: only cigarette smokers, non-cigarette smokers, e-cigarette smokers, ex-cigarette smokers, and dual smokers. All participants were classified into the following insulin resistance groups according to the median triglycerides indexes 8.5. The laboratory test data were processed in the statistical program's SPSS version 21 to understand if there is a statistical relationship between the lifestyle factor and the triglyceride glucose index. In table number 1, we present as the statistical relationship between the body mass index and the triglyceride index. According to statistical processes, we have a statistical significant relationship P0. In this table, table number 2, we can say the indicate the statistical relationship between cigarette smoker, the amount of the daily cigarette smoking, alcohol drinking, and the triglyceride index. You can see that the value of P is 0, and this is important because this tells us that is a strong relationship between these parameters. In table number 3, we can see the relationship between the use of medication and triglyceride glucose index. You can see that the relationship about the amount of cigarette and triglyceride glucose index. About the statistical processing, you can see that the value of P is 0. It's important because it tells us about a statistical relationship very stronger. In this table, you can see the relationship between the triglyceride glucose indexes and the quality of smoking cigarettes for days and the triglyceride glucose indexes and physical activity. From the statistical processing, an important statistical relationship between them can be seen because the value of P is 0. Conclusions. Insulin resistance can be evaluated through the triglyceride glucose index, a low-cost and easy-to-apply methods which can predict the risk of patient development pathology such as cardiovascular disease and type 2 diabetes. There are some studies that show the role of this index in predict cardiovascular events with sensitivity and specificity, and there are some studies that see the role of this index about the diabetes type 2. 3. Since a sedentary life is important for this pathology, this study discussed the relationship between the triglyceride glucose index and the sedentary life of students after the COVID-19 pandemic. Our study found a statistical significant relationship between sedentary factors such as alcohol, physical activity, body weight, and smoking, and triglyceride glucose levels. These results are probably related to the lack of physical activity due to isolation, perhaps due to the increased consumption of alcohol and cigarettes as an anti-anxious tool to overcome the isolation. However, this should be verified in the wider group. At the end of this presentation, I want to dedicate it my colleagues as the way to show my gratitude to them, Dr. Iona Carey and Iris Placo. Thank you for your attention.